In this week's lecture, we will cover assistive technology approaches to teaching early communication and literacy. As you may know, communication typically involves the exchange of information between two people. Typically, children learn language through what they see, hear, touch, smell, and experience. It is important to remember that there is no genetic code that leads a child to speak English, Spanish, or Japanese. Language is learned. We are born with the capacity to make 40 sounds, and our genetics allows our brain to make associations between sounds, objects, actions, or ideas. The combination of these capabilities allow the creation of language. Sounds come to have meaning. The babbling sound, ma 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 ma, of the infant becomes mama, and then mother. In the first years of life, children listen, practice, and learn. The amusing sounds of a young toddler practicing language in seemingly meaningless chatter is really their modeling of the rhythm, tone, volume, and nonverbal expressions they see in us. Language, with all of its magnificent complexity, is one of the greatest gifts we give our children. Yet, we so often treat our verbal communication with children in such a casual way. It is a misconception that children learn language passively. Language acquisition is a product of active, repetitive, and complex learning. Adults help children learn language primarily by talking with them. It happens when the mother coos and baby talks with her child. It happens when a father listens to the fractured, rambling, breathless story of his 3-year-old. It happens when a teacher patiently repeats instructions to an inattentive student. They will also learn language through outside factors, including a print-rich environment, computer and television media, as well as their school environment. As with anything, there are numerous factors that can interfere with one's language development. In fact, it is very common for teachers to have children with speech and language delays. The process of learning language can be impaired in many ways. These can include difficulties in hearing, problems in making associations between sight and sound, attention deficits, and a limited background of experience. A child's language skills are directly related to the number of words and complex conversations they have with others. In order to learn the relationship between sounds and objects, a child must hear, and then make the association between what that sound symbolizes. If a child hears few words, or if a child is rarely read to, sung to, or talked with, she will not have normal language development. Children who grow up in verbally and cognitively impoverished settings often have speech and language delays. In more extreme situations, children neglected by their caregivers can have completely undeveloped speech and language skills. Fortunately, the parts of the brain responsible for language are very malleable. Given opportunities to hear, talk, and have complex conversations, these children can catch up. The challenge for the early childhood teacher is to make sure that these children have many developmentally appropriate language activities. It is important that concerns about delayed language skills are shared with the family and other school personnel in order to properly diagnose potential causes. Many parents are inexperienced and may not be aware of what is normal language development at any given age. Early childhood classrooms are one of the most important settings for early identification of language problems. Children may also experience language delays due to other factors including social, cognitive, motor, and sensory disabilities. Delays in developing language, such as dependency on non-symbolic behaviors. Fortunately, there are many technology tools that support early communication development, such as switches. Switches offer the following features. They offer direct instruction in cause and effect. They offer interactions with the environment. They also teach choice. A good example of a switch is a simple AUG-COM device. These are often used as a single message communication device. There are many types of switches that one can use, including a generic push, a leaf, a squeeze, a pinch, a muscle or twitch, one that is light sensitive, or something that vibrates. Depending on the needs of the individual, the use of a switch will vary. Switches tend to be activated by pressure, motion, airflow, light sensitivity, or sound, such as the clucking of a tongue. Most switches will respond to minimal movement. Pressure switches will respond to the pressure of hand, food, the head, or body part touch, even as simple as the blinking of an eye. Airflow switches will move a wheelchair. Switches are as individualized as the child's needs are. The child's needs to be assessed for the best switch, and a trial period will ensure which switch type is best for the specific child. Ultimately, the appropriate switch should be decided during an IEP meeting in consultation with the parents, special education teacher, occupational therapist, physical therapist, and other key stakeholders. This decision-making process must consider the following factors: position, motor behavior, type of switch, and instructional procedures. One also wants to assess the level of literacy of the student. More specifically, is the student pre-linguistic, an emerging reader, or a conventional reader? For example, an emerging reader will browse books. They will respond to questions. They will also listen to read-alouds. Once all of these factors are considered, the IEP team will need to decide what kind of assistive technology they will deploy. For example, assistive technology includes one-step communicators, low-tech adaptations, talking books, books on MP3, early literacy websites, as well as the ever-popular apps. One should also consider authoring software such as iBooks, KidPick Studio, PowerPoint, and Pixie. Pixie is an exciting creative software that students can use to share ideas, imagination, and understanding through a combination of text, original work, voice, narration, art, as well as images. Pixie engages students in their learning by creating with technology that appeals to diverse learners with a wide variety of learning styles. It also encourages thinking, creativity, and communication skills. Pixie can also motivate a wide range of learners. Pixie ultimately helps all students produce high level work and produces a sense of pride in their abilities and fosters a determination to achieve. Similarly, KidPix Studio is another great tool for promoting early literacy. If your kids love to draw and paint, they will love to use KidPix Studio. This program combines the amazing KidPix R program with some exciting new multimedia tools. Students can animate their illustrations and make slideshow presentations complete with sound, text, and great special effects.